today we're talking about an immunotherapies in the cancer treatment that called the T-cell transfer therapies, and this therapy to create a CAR T-cell to help detect the cancer cell. And the CAR T transfers is a technique that involves taking the T cell in the patient bodies and genetically modified to produce the CAR. And currently, the CAR T cell therapy is customized for each patient, and the treatment begins by collecting the T cell from the patient body, and then the T cell are sent to the laboratory to be reproduced to carry the primary antigen receptor. We can call that the CAR. The CAR is the protein installed on the surface of the T cell that allow them to recognize and binding specific antigen or protein that appears on the surface of the cancer cell. And by installing the CAR receptor, the T cell can actually identify and attract the cancer cell, so it can have the immune system overcome the natural limitations and destroy the tumor. So after that, they are expanded into laboratory into the million of the cell, and it diffused back into the patient body. And into the patient body, the CAR receptor 2 can recognize and destroy any cancer cell that display the target antigen on their surface. Today, there are 5 generations of the CAR that distinguish based on the structures and characteristics, and depending on each patient and their response, the doctor will choose the appropriate generations. But however, each generation has some side effects, so receive the solutions is extremely important for the patients. For example, for the doctors can use the tocilizumab, which is the drug can decrease the cyto release syndrome. Moreover, the CAR T cell therapy is customized for the each patient, so the cost very high, around the $300,000 per treatment. So reduce the high cost is also the concern. There are 2 ways you can create a CAR T cell, that is the virus vectors or ribociclib. For the virus vector, we can use to retrovirus and lentivirus. Ribociclib, that's a precise genetic things. The doctors can combine the CAR T cell with another methods such as a checkpoint inhibitor, cytokine therapy, and radiations and chemotherapies. For the checkpoint inhibitor that can overcome the tumor immune invasion mechanism, cytotherapies that can enhance the CAR T cell replications and activities, and the last one is radiation and chemotherapy that can reduce the immune competitions and enhance the CAR T efficiency. And that's the end presentation. Thanks for your listening.